Have you ever felt so overwhelmed with stress it causes you to lose control of your breathing? If so, you may have experienced a panic attack. So I want to start off by the simplest definition of a panic attack is a sudden episode of intense fear that triggers severe physical reactions and there is no present danger around you. Sometimes when people are experiencing a panic attack, they may feel like they are dying. Most people only have one or two panic attacks during their lifetime. Others have recurrent, unexpected panic attacks, which then they are diagnosed with what they call panic disorder. Some symptoms of panic disorder include difficulty breathing, nausea, pounding chest or heart pain, dizziness, and even sweating. It has been found that panic disorder does run in family histories. Also, another cause of panic disorder include substance abuse, because that can trigger the fear and anxiety responses in your brain. Also, major life stress such as death in the family can also cause panic disorder. There are ways to treat panic disorder, but first the patient or client must be diagnosed. The first step the doctor has to do is make sure there is no mental illness in the patient before he can diagnose them with panic disorder. If the patient then is diagnosed with panic disorder, then the doctor will decide which method of treatment to use. So the first treatment that is offered is psychotherapy, which focuses on the emotional response to mental illness. Another method of treatment is cognitive behavioral therapy. It's a type of psychotherapy that helps a person learn to recognize and change thought patterns. And of course, medication is another method used. There are antidepressants and anti-anxiety medicines. An antidepressant, for example, is Paxil or Zoloft. And anti-anxiety is Xanax or Ativan. Also, to avoid having to take medications, most people use relaxation techniques, such as meditation, like yoga, and also just learning how to control your breathing. Researchers also say that if you reduce your caffeine intake and nicotine intake as well, that will reduce your panic attacks. Also, if you eat a healthy diet and exercise daily, that'll relieve some of that stress and not cause you to have a panic attack. So I really want to stress this part. If left untreated, if panic attacks are left untreated, it can result in severe complications. For example, you may be in a constant state of fear. You may develop certain phobias, such as you don't want to be around people, or even germophobia is an example of that. You also might have problems at work or school, and depression also may come into play as well. Another thing is you can start to abuse alcohol and drugs if left untreated, because you may always feel depressed and like no one understands what you're going through. And the last thing I want to stress about not getting panic attacks or panic disorder treated is financial problems. You could be losing money due to spending it on drugs or alcohol. So I really want to stress that if you are experiencing panic attacks, first to get diagnosed with panic disorder and then get treated right away, either by therapy or by meditation. So I want to leave off with a couple of things. Panic attacks are most common in women more than men. Researchers have found that. Also, I really want to stress that if you are having reoccurring panic attacks, then to go get diagnosed or see if you have panic disorder. If you are diagnosed with panic disorder, do not feel discouraged. because there are methods of treatment that you can do, and you can still carry on with your daily routines. So I want to go ahead and stress those few factors, and I hope you all take this information and spread the word if you know anybody that has panic attacks, or if you yourself have panic attacks, definitely get them treated. And if you don't, just try meditation techniques, and yoga is a really good way to get those panic attacks down. So I hope you all enjoyed the information you learned today and take these thoughts into consideration.